At Messino Cancer Centers, what we try to do is we try to take care of the whole patient. And to do this, we employ every resource that we have to make this process as easy for you as possible. Fighting cancer is more than just getting your chemotherapy and getting the cancer under control, but there's the emotional component to this, there's the physical component to this. And I tell my patients, anything that I could do to make this journey easier for you, I'm going to pull out all the stops. And here at Messino Cancer Centers, we have a lot of resources that we can employ to help people through this journey. For many of my patients, they can't eat. Gallbladder cancer makes you nauseous. It's hard to maintain your weight. And the weaker you get, the harder it is to get through your therapy. So we have a nutritionalist on staff to make sure that we start working with these patients out of the gate to make sure that they can maintain their strength through this entire process. We understand the emotional toll that this takes on not only the patient, but their spouse. And many of our patients struggle trying to find support going through processes like this because they don't always feel like they want to put extra pressure on their loved one or the patient who's fighting the cancer. And for that, we have a behavioral health therapist who could sort of step in and provide and be that pillar of support, particularly in these challenging situations. But along the spectrum of disease, making sure that we have good control of symptoms. Symptom management can be critical in terms of how well a patient can get through their treatment and to make sure that a patient gets through all of their treatment. And to do that, we have palliative care services, which every step of the way, they're there to support the patients and control their symptoms. And, in addition, to all these other services that we provide, we make sure at the end of the day that our patients have the best cancer care possible. We employ some of the newest laboratory techniques, next generation sequencing, to create a roadmap of a patient's cancer so that we know their cancer's strengths and we know their cancer's weaknesses, and we know the best way to kill this cancer using drugs that aren't very toxic and can maintain a person's quality of life. Some of the other things that we do to help patients through this journey is we find them clinical studies to participate in. And we're constantly looking at what cutting-edge research is being done not only here, but across the country to see if we can get our patients plugged in to these types of studies. But really, at the end of the day, we're here to serve our community. And the community of Western North Carolina, does have a broad footprint. And many of our patients don't have the means or capabilities of traveling to larger centers to get their care. But we do everything possible to make sure that our patients here get the best clinical care possible. And it's not uncommon for me to pick up the phone and call the world expert in esophageal cancer or pancreatic cancer or gallbladder cancer, to get their opinion on how to manage a complicated case. And very often they're very willing to provide feedback to me and make sure that we're all on the same page in how we manage these patients' cancers. And for many of my patients, knowing that the world expert is but a phone call away, it gives them the peace of mind knowing that at a community-based cancer center like Messino Cancer Centers, they're getting the best care possible. As we go through this journey, as we try to fight gallbladder and bile duct cancers, the key to being cured from this disease really is having an excellent oncologic surgery. And in order to have the chance for being cured in this particular setting, you really need to go to a surgeon that has a high volume of surgeries for this disease. And whether it's an academic center or a community-based center, as long as you have a surgeon who has the experience and who does many of these surgeries every year, that's going to give you the best chance of having a successful oncologic outcome and the best chance for being cured.